Thank you so much for staying in the Monday Report Town Hall. Many questions coming through. I'll try and get through them as much as possible. We are separating the facts from the fiction on the coronavirus crisis. Vincent Babu says, does Kenya have capacity to test or diagnose? And if yes, where? By last week, WHO reported that only 6 African countries can test for coronavirus. They are South Africa, Ghana, Nigeria, Sierra Leone, Madagascar, and Senegal. Senegal has reported the first case, by the way. The rest of the African countries have to send samples for testing elsewhere. So do we have the capacity to test, Professor? And
yes,
where?
we do. I think 2 weeks ago, the Ministry of Health, through the National Reference Lab, received reagents. So there are actually 2 labs in the country now. The one at the National Reference Lab, the other one is an influenza lab that have the capacity to actually test.
Okay.
We don't need to send these samples outside of the country.
How fast can we get the results? Because there are 2 German nationals who are in quarantine right now as we speak in Mombasa. They're suspected cases of coronavirus. That just came to our newsroom a few minutes ago. How long does it take to test generally?
What I will say, within 6 to 7 hours, 8 hours, with the kind of tests that we have, one should actually be able to say whether you are dealing with coronaviruses or whether that infection is because of another. Because when you come in with flu-like symptoms, they are not only going to test corona, they will test other viruses as well that are likely to cause. So they will tell you it's not corona, but maybe it is flu or something else. That is actually what is going on. So between 6 to 7, 8 hours, one should actually be able to have their results out. And we have Boaz Onchari, the chairman, Kenya National Union of Nurses, Nairobi County branch. Kindly just pass the microphone to him. Boaz, I'm more concerned because you are the primary caregivers. What are the people in your profession saying? Are you ready to tackle coronavirus should it come to Kenya?
Thank you, Trevor, for giving me this opportunity. I want to start by saying that it is very unfortunate that even we speak on preparedness, we are not sure whether as a country we are prepared. The reason as to why I'm saying this is it is clear that we are reacting to a knee-jerk order by the president that within 7 days we should have a fully functional set-up unit at Mbagathi Hospital. This message was brought back way on 28th of January. We dilly-dallied until the president has to give an order so that we can see things working. You cannot go and buy a car, then you remember that I don't know how to drive. Remember, even as you equip those institutions, you need what we call human resource. And then this begs the question, do we have enough equipped with knowledge, human resource on how to handle this virus? And I can tell you for a fact, in Nairobi, I represent nurses, it's a no. As we speak, I only know of 3 health workers who have been trained. So if you're talking of an institution with a 120 capacity, against the 3 individuals that I can stand firm and say that these are the ones I know, then how prepared are we? You remember a case that happened in Makueni when there was a suspected case that actually walked in. The medics were the first one to run out. So if a medic can run out of an institution, where do we leave our clients? On whose hands? In medicine, I believe even Professor can attest to this, that each case is treated in its unique way. When you come into a consultation room, whether you are coughing or you have a headache, I will not compare you with the client I saw earlier with the same symptoms. I will treat you as a unique case with your unique symptoms. So let us not assume, because there is this essence that there were people who are trained during the Ebola case, and then we feel that we may use the same people for whatever we have at hand. In medicine, we have what we call continuous medical assessment. So if you trained me last year, I need a refresher course. Even with the masks that have been, Dr. has talked about, even the surgical mask that we use, it is not just to pick a mask and put it on. That mask has two sides. And it has to be explained to even the user that this side is for A and this side is for B. With the N95 mask, most institutions are struggling even to get the N95 mask. So when you are talking of guys getting these masks, and I know one is they are expensive, and even as we speak now, maybe they are scarce in the country. Look at a health provider, a primary health provider at the remote area in Turkana, for instance. For you to access a level 4 or level 5 institution, it will take you more than 100 kilometers. So training is key in terms of whatever we are facing. If you have no capacity in terms of human resource, even if we have a well-equipped facility, we have well-equipped level 5, then it is good as nothing. So even as we ask ourselves whether we are prepared, we need to be at least open our hands and wings and look at it from a broader perspective.
Okay.
Let us not just train some individuals with an intention that they are going to react with whatever is coming. Remember, even as these guys are coming in, they are interacting. They are moving out of Nairobi to other areas. Yeah. What if he or she gets such symptoms, and the first point he or she will run will be in a dispensary? Okay. What will happen with that nurse at the dispensary? Okay. He or she has no information. Yeah. She has not been empowered, or he has not been empowered in the knowledge. Yeah. So let us not just react to that we must have a fully equipped. Let us also look in terms of human resource. So the bottom line is, from our perspective, we are not prepared.
Okay.
Yes.
Alfred Mukenya on Twitter says, no vaccine for coronavirus. It would be an exercise in futility, since it takes much longer to develop and produce a vaccine than for the virus to mutate. Is that true, Masika?
Well, it takes time to develop a vaccine. He's right.
But will the virus mutate?
Well, it may mutate, and we know we have not managed to get a working vaccine for coronaviruses. Yeah. But it's not to say that the feat is impossible to achieve. It's just that it's going to take a long time, and by the time we get one, it's likely that the outbreak could be over. Mm-hmm. But that doesn't mean we stop looking, because it could also be possible that the virus outbreak continues. So vaccines do take time, and by the time you develop one and test it and show that it works, yes, it may be too late.
Okay. Yeah. Professor Wanja Douglas says, I think Kenyans should know that coronavirus is not a death sentence, but the stigma associated with the virus and lack of information about the spread and ways to protect ourselves will be the hardest thing to fight when we have a confirmed case here in Kenya. And that comes to another conversation here. It's not as virulent, which is aggression to the host, as the H1N1. Why is this such a big conversation?
I think the big conversation is, I think, the way it was started, and maybe the way Wuhan, 60 million people were suddenly put on lockdown. That could have been the genesis of the stigma, and that could have been the genesis of the fear and the genesis of the panic. Mm. And really, what I also like to address is the whole issue of the healthcare system. What we need quickly and very fast is to build confidence among the healthcare workers. You cannot run away. You are the people who are on the front line. So what we need is education, and more education. Mm. What I would like to hear from the ministry is that putting up Bangadi and expanding isolation is good. But I want to know that the same thing is happening in Busia, the same thing is happening in Kakamega, all right? Same thing is happening in Mombasa. So we are being told, should there be a problem in Mombasa, this is where the isolation will take place. Should there be a problem in Busia, This is the isolation that will take place. We also need to be told in the various regions what is the quantity of the protective gear in terms of the masks and continuous training. All right? Because of what we have heard about community transmission, it heightens us to have a very high index of suspicion. So what we really need now is good communication. But again, going to the level is that you may not be able to test in Busia as a nurse or as a doctor. But what do I give you? What tools do I give you to have a high index of suspicion? And that's why we are requesting that we should come up with a syndromic what? A syndromic approach. Where you are educated that if there is A and B and C and D, there's a high index of suspicion. Then what do you do as a healthcare professional? If all that is done, then this panic and fear we have among the healthcare workers will actually do what? Will actually disappear. And that is the kind of communication we are going to expect from the people who have been charged with this responsibility.
Dr. Masika, there's another one here. Nicodemus Mwania says, on average, how much is the mask and is it readily available?
I think the N95 which healthcare workers use could be anywhere about 400 shillings or thereabouts. Not the younger one, but the other one is much cheaper, but I can't tell you how much. I would also like to weigh in on what Prof has said, that we have healthcare workers who are not confident of preparedness. Now, if you wait for the government to come and train on everything, it's going to take a while because of logistics. Now, we all know if in a football team you may have very good football players, but it takes some drilling and common practice to become a good team. What you can do at each facility is to actually sit together and you have understand the situation and say, this is what we have, this is what we need to be prepared, and this is what we'll put in place. If a patient comes, we will do A, B, C, D. That will give the teams in each hospital some confidence on what to do in case of a suspected case. I think so. For the masks, I think the message we should get out is that you should not all wear a mask. The masks are primarily for healthcare workers, and these are some of the supplies that government needs to make sure are in each, and government includes national and counties, are available in each facility, and not necessarily to each person, because we all can't use masks. They won't be useful.
Okay. Yes. We have another one here from Olema. I don't know whether this is a serious question or is just being cheeky. Saying, ask doctor whether this coronavirus could be transmitted through kissing. I won't ask the other one.
Yes.
Okay.
Yes,
very,
of course.
very, very easily through kissing and intimate contact. Actually, if you see somebody coughing and who has a flu, you should be at least 2 meters or 6 feet away from that person.
2 meters or 6 feet.
It will be difficult to kiss from 2 meters away.
Okay. Let's see another one here. Linus Ikapel says the healthcare workers use the thermal gun on several persons. How safe is this screening? And at what stage is the virus infectious? I mean, can it infect someone before the fever or coughing stage reaches?
I think the epidemic is evolving. New information is coming in. Before, we all thought and we all agreed that the virus is only transmitted when somebody begins to show the signs and symptoms, issues of cough. But now there is information coming in that there could be people who may transmit the virus without these symptoms or very mild symptoms. Hence, the idea that precautions, high index of suspicion should actually be there. So maybe this virus could be transmitted before the signs and symptoms occur. But that information is trickling in very slowly. And if it does, then we must begin to think of what measures do we put in place. And chances are that this could be individuals who have had exposure and maybe who are under maybe isolation already. So the chances again of transmitting to somebody might actually be low.
Okay. Masika, Benson Mogaka says, how long is the incubation period of coronavirus?
On average, we've seen 5 days, but it could be as short as 2 days, as long as 14 days. So it's pretty varied, depending on how the exposure and the person's immune system how it interacts with the virus. So up to 14 days, which is pretty long, especially if you have to be quarantined for that duration just to make sure you're not sick.
Yeah. Mugambi Oliver says, my question to Professor is whether infected patients develop secondary immunity after recovery so that they can't be reinfected.
Yeah, that's interesting because those are some of the things we have actually been asking ourselves, and information is trickling in terms of recovery. But you see, recovery can mean two things. You can recover because your immunology has been able to, your defenses have been able to take the care of the virus and ensure that you recover. But you may again recover and not develop ability to avoid subsequent infections. Mm-hmm. So what I can say now is that we don't have sufficient data to say that once you've been infected, that you cannot be infected again. Okay. But what we know is that there's a high likelihood that once you've been infected, you develop immunity. It's unlikely that the same virus will infect you again. And that is actually the basis of how we develop vaccines. We develop vaccines following exposure, you recover, you develop immunity, then we use that immunity that the body has taught us to then actually develop a vaccine.
Okay.
Yeah.
Masika.
Yes.
I'm Kennedy Omune from Kangemi. How can people with one room in a slum with a wife and children quarantine?
It's a very good question. Again, what is the risk? And if you have been exposed, then you consider the options within your means. Of course, in one room, it's very difficult to self-quarantine, but you may consider relocating in a place where you can get that room. Of course, economically, that's a challenge. So in such a situation, it becomes very difficult to self-quarantine. And I think if you really consider yourself at risk, I would suggest the ministry has provided hotlines. You can call them and they'll advise you if you need to get tested, depending on if you have any symptoms or depending on your risk, because you can't really isolate yourself in a room of 5 people in the slum. It's difficult.
It's difficult. Mm-hmm. Professor Faith from Gong Road says the professor has said that we should not touch surfaces. What about those of us who are using public means of transport? How do we get into the car?
Nice one. Get into the car, but as we have said consistently, when you get to a place where you can wash your hands with soap and water, wash your hands with soap and water. If you have ability to walk around with a sanitizer, do what? Consistently use a sanitizer to do what? To sanitize your hands. I think those are not difficult measures.
Okay.
Yes.
While in the car, avoid touching your face and eyes and so.
Exactly.
All right. We have questions here. Yes, before I get into them, you have the microphone. Go ahead. Very brief questions because we are running out of time.
Yes, thank you, Trevor. My name is Patrick Masharia, and it is my understanding that the virus is zoonotic in nature, meaning that even animals could spread the virus. Now, should we be worried of our pets, like cats, dogs, and such other animals that are within close range?
All right. Let's take the next question.
My name is Omondi. I'm talking on behalf of parents. You see, kids really go to school and they play in public. They really interact, and they're saying that the kids, they have a lower risk of being infected. But you see, parents, they have to interact with their kids, and when they come to the houses, they really interact with the surfaces. Yeah.
Okay.
And then number 2, we can see that now the Americans, the president is talking about America first. And when you've had such catastrophes, America has always been the leader, the international leader in terms of coming up with solutions. Is it time for our governments to invest in research and to even bring confidence in our doctors, so that our government officers, when they are sick, they don't run to those countries? Actually, don't expect these clinical officers to have confidence in themselves, while our policy makers, when they are sick, they rush to those other economies.
Okay.
Yeah.
Let's answer those really fast and then I take a break. Pets.
Yeah, I mean, there has been this concern about pets. Theoretically, it's possible to get infected by pets, but the main driver of this infection currently is human-to-human transmission. In fact, you're more likely to infect your pet. So we are not seeing a lot of cases where the infection is coming from pets. So right now you don't need to worry about the pets so much, but take care of them, make sure they're healthy, and if you see any symptoms, of course, get them treated by a vet. If you have a pet, you need to make sure you invest in making it healthy.
Okay. Professor, school-going children and parents interaction.
But in addition, if there's any suspicion that one could be infected and you are under self-quarantine, avoid your pets.
Yeah.
Because you are likely also to infect them. Or you could, through that process, they may not be infected in terms of carrying the infection, but they could act as a surface where they can move that infection from one place to another. So those are the precautions we need to take. Now the question on research and the question on, you see, research is ongoing. We at our institute at CAVI, we are doing a lot of research to really understand the environment, because these infections are coming from the environment. So that is ongoing. So what we just need is to do more to ensure we have surveillance, to ensure we have a high index of suspicion, to know that maybe these are the areas where an infection from the wild could easily spill over into the humans, and ensuring that we have epidemic preparedness. We cannot always wait for the US, all right? We cannot always wait for what? For the US.
Yeah.
There are things we can actually do for ourselves, because the knowledge is actually there.
Okay.
It's actually ensuring that we put in enough resources to have surveillance in place.
All right.
Yeah.
I'll take another quick break here on the Monday Report, the Town Hall session. 22422 is the SMS line at Trevor Mbiji at Citizen TV Kenya. Hashtag Monday Report. I'm trying to squeeze in as many of them as possible because we're running out of time here. Tonight, we're separating the facts from the fiction. See you in just a bit.